5 months. That's how long it's been since the first coronavirus case was reported in the U.S. Cases appeared to be on the decline in May, but they started spiking again in June. Now, experts are wondering if some states reopen too soon.
We need to open everything back up. Some of the measures they're putting in place are asinine.
Though these times feel unprecedented in many ways, it's actually not the first time the country has faced a crucial moment like this. That's because of the Spanish flu. Just over 100 years ago, an H1N1 virus infected a third of the world's population and killed over 600,000 Americans. There was no vaccine, so cities relied on distancing measures like closing schools, businesses, and other public gatherings. Some even required their residents to wear masks. This led to backlash from business owners who pressured cities to reopen. Sound familiar? Well, as cities eased guidelines, some were hit with a second wave of the flu. Take San Francisco. They closed schools and banned public gatherings after flu cases were reported in October 1918. They also recommended face masks, though many residents didn't take that suggestion seriously. A mask mandate followed, but not everyone complied. For example, one woman declared the ordinance, quote, absolutely unconstitutional because it wasn't signed into law. After about a month, the city's restrictions were lifted. San Franciscans took to the streets, removing their masks in triumph. A few weeks later, the city faced a second wave. This wasn't the only city that eased their policies early on. After Denver shut down establishments, business owners pressured the city to quickly reopen. They revoked measures on November 11th, Armistice Day, when thousands gathered to celebrate the end of World War I. When doctors reported a spike in cases, a Denver health official said, quote, the people themselves are to blame for the increased number of cases and deaths. Other cities like St. Louis, Birmingham, and Omaha also saw an increase in cases after lifting closures around the same time. And studies suggest that many of these second waves were tied to relaxed guidelines, whereas places like New York City avoided additional surges by maintaining distancing measures until cases hit a sustained low point. Though there are parallels between the Spanish flu and the coronavirus, no two pandemics are alike, and there's still a lot we don't know about COVID-19 and how it could spread as places try returning to some form of normalcy. But as states decide how and when to reopen, history can provide clues as to how similar situations played out in the past.
29% of the COVID-19 tests in Arizona came back positive today. NBC News reporter Vaughn Hilliard joining me now from Phoenix. And Vaughn, 29% is real high. What are state leaders and doctors saying about all of those positive cases?
Doctors are telling me here today what they were telling me yesterday and what they told me the day before here is that this needs to be brought under control here, because the way that this trajectory is going only continues to skyrocket. And that is when you see that 29% positive number, that means 1 out of 4, or almost 1 out of 3 individuals who are getting tested get a positive result back. And what that means, too, in turn, is that you're going to have sicker people a week or 2 weeks from now once that incubation period passes. And the hospitals are already sounding the alarm, saying that they're at near capacity. Several hospitals have already been using the state surge line to send patients to other facilities. And so when you're talking about a 29% positive number, knowing that just a month and a half ago that was more around 5 or 6%, that is a deep cause for concern, especially as just last Sunday it was at 23%. So as those numbers continue to rise, so far you're not seeing action from the state level so far helping slow the curve here at this point.
Vaughn, I know you also spoke with the head of the Arizona National Guard. How are they helping out?
Exactly. That was my question, is where does the state of Arizona go from here? There's going to be plenty of question marks about looking towards the past, but the state finds itself in a situation now where it needs the resources, it needs staffing for their hospitals. I had the chance to catch up with Major General Michael McGuire here in the heart of Phoenix. He is not only the head of the Arizona National Guard, but he's also the director of emergency management here for the state of Arizona, working right alongside with Governor Ducey, as well as the Arizona Department of Health Services, Dr. Kara Christ. He has been working on this front, and he said that after the meeting with Vice President Pence yesterday here in Phoenix, that they are working to bring in more than 500 medical professionals to help the facilities across 4 different counties here in the state. There were specifically 6 hospitals that requested staffing help. I know one of those was down at Yuma Regional Medical Center, where we were at last week, saying that they just simply did not have the number of medical professionals it took to maintain proper services at their emergency facilities. And that is where the state was finishing up a contract to put out today to bring in from out of state those 500 individuals. Already here, heading into this weekend, they'll have about 125 federal workers from DOD, from the VA, from Human and Health Services to temporarily stand in. They also will be having next week 300 National Guardsmen who will be taking part in essentially contract tracing efforts here at the county level, helping make those calls to folks that they know have been in contact with individuals who have tested positive. I was also talking with the General McGuire. He was telling me that they have already one facility. This is the old St. Luke's Hospital that is up, ready to go. They have 334 beds. A number of those could be ICU-type beds that if the hospitals simply become overwhelmed, they're able to turn that particular old St. Luke's Hospital back into a functioning hospital at this point. And take a listen to General McGuire when I asked him about the efforts here and what the National Guard is able to do right now.
So the contact tracing, what we're calling it for our guardsmen is disease notification. We don't have qualified we have one qualified epidemiologist in the 8,200 members of the Guard. The counties each have a county health director that has contact tracing ability and the technical skills to do contact tracing. What they lack is the labor force to make the phone calls to the individuals. So we've already procured enough equipment and trained the first 40 personnel that are working right now.
And that's where the National Guard, 8,200 guardsmen strong, are trying to figure out where they best can service this state. There's also an additional potential facility in northern and southern Arizona that they have said they've already completed a planning evaluation for if it is necessary to work with the U.S. Army Corps of Engineers to turn one of those facilities into a pop-up field hospital as well, Allison.
Vaughn, how about help from the federal government, other states? Who else is giving Arizona a hand?
This place needs help. The Vice President of the United States said yesterday that they were well prepared for what was at hand. At the same time, it's really tough when you're talking to these healthcare professionals to get a good grip on just the expansiveness of the spread of COVID here in the state, particularly because testing is still limited here, and the ability to process these tests. Just 11,000 tests in the entire state were taken yesterday, to give you an idea. And that is where a lot of the concern is, the unknown. You have those 500 medical professionals that are expected to be able to make their way in, but exactly where are they coming from, and to what extent are right now 6 hospitals are saying they need the support, but will they have to expand that number? Right now that contract is out for just 6 weeks. Will they have to expand it beyond those initial 6 weeks? Those are some of those questions here are at hand, and even more of a concern is when you see California next door, Texas 2 states over, also increase their demand. You've got to begin to question and really send out that warning shot to other states that if you're seeing an increase, take this seriously now, clamp down, wear masks, have people stay at home, because the country can only afford to have so many Arizonas right now.
Vaughn Hilliard in Arizona. Thanks so much, my friend. Businesses in California trying to keep up with the ever-changing guidelines there. The governor saying that restaurants in 19 counties need to shut down indoor dining as the state is seeing an increase in coronavirus cases. NBC News correspondent Aaron McLaughlin is joining me now from Los Angeles. And Aaron, restaurants could only have indoor dining for a couple of weeks, then had to shut it down again. I can only imagine how frustrating that has been. What are they telling you about dealing with that and trying to stay afloat financially?
Extremely frustrating and difficult situation for restaurant owners here in Hollywood. I'm joined now by the Marino brothers, Sal and Mario Marino. They own this restaurant, Marino Ristorante here in Hollywood. They have been impacted by Governor Newsom's latest mandate, closing down indoor operations in restaurants across some 70% of California. We're in an outdoor space right now, so they still have that as a possibility. Talk to me about how this outdoor situation, this outdoor dining space came to be.
I'm Sal. This is Mario. Hi, everyone. And really, this was our parking lot. We took advantage of the relaxed new regulations that allowed us to serve outdoors and serve wine, beer, and liquor. So here we had it, and we transformed this 1,500 square foot parking lot into a beautiful outside dinner patio. And you transformed this parking lot just a couple weeks ago. Overnight, yes, in early June, right before. Then the riots happened.
So you had to deal with that. And what was that like?
Well, that was a complete shutdown. But onwards and upwards, we're here now. We're serving dinner on our outdoors, and people love it. At nighttime, this is all lit up, and it's really, really, really nice.
Talk to me about the overall impact on your business, though, Mario.
Impact? In which way?
How has it impacted you financially? How has it impacted your operations? How has it impacted your customers?
Well, impacted financially on the different perspectives. Number one, loyalty towards our staff. Our staff, which has been with us for so many years, we've now come running into the obviously problem of not having them because we don't have tables. People, when they do make reservations, some people still don't show up. And so that's a challenge. We're all just working and learning day by day. I mean, this is not... There's no manual for this for any of us.
The fact that indoor dining has been shut down once again, you're saying that hasn't had too much of an impact on the current situation. Why?
Well, because on a fun note, when people came to find out that we had a patio, everybody rushed to want to eat outside for those who ever wanted to come in.
So people didn't want to eat inside. Did that make them nervous?
Eating inside? Probably.
Inside, yes.
Everybody wanted to sit inside. I can count on one hand in 1 month of operation, the month of June, how many people want to sit inside. Everybody wants to be outside.
You told me that the current situation has also had an impact on your ingredients. You source a lot of your ingredients from Italy. Talk to me about that.
Well, when the travel ban shut down, the beginning, immediately, everything that is air freight, from our seafood to the fresh mozzarella, to the cheeses, to the specialty items, that was immediately gone. So after we went through our stockpile and our local pile, we didn't have all that. So yes, we had to make amends in different things. And that was from the seafood from Japan to the cheeses from Europe that are air freighted in. Now the flights have resumed, so there's a little bit more continuity, regularity to it. But yes, it was a tough time to get, notwithstanding the increase in prices on poultry, on meats, on vegetables. Ricotta is so hard to get. In the beginning it was garlic, and then there was eggs impossible to get, and then it was milk hard to get. So you roll with that.
Sal and Mario Marino, thank you so much. As you can tell, Allison, for restaurant owners across California, it is an ever-evolving situation.
Erin, thank them so much, and thank you for giving us a glimpse of what restaurants and folks there are dealing with. Appreciate it. Utah confirming more than 10,000 active coronavirus cases for the first time since the start of the pandemic. NBC News reporter Maura Barrett joining me now from Salt Lake City, Utah. And Maura, I know you've been talking to doctors there. What are they telling you about the situation in Utah right now?
Allison, the overall picture here is not good. Basically, Utah is seeing a spike of coronavirus cases for the first time since the pandemic began. Back in March and April, when we saw other states on the East Coast and in California spiking, they weren't experiencing that. They were seeing a low count increase each day. It plateaued pretty early, and they started seeing this major spike around June 1st, right after that Memorial Day holiday. One doctor said it kind of overlapped between the reopenings and Memorial Day, and so they're very concerned going into this 4th of July holiday. today. But the problem here in Utah is that because they haven't experienced it before in the last 3 months, they don't know really how to handle it moving forward when it comes to hospital capacity. They're worried about the hospital system being overwhelmed. Even here at testing sites like these, they're running short on supplies. So 3 testing sites ahead of the holiday had to shut down because they weren't able to test people adequately. And so the state epidemiologists here and other health officials are getting increasingly nervous that they're not going to be able to curb the spread of the virus here in Utah.
All right, let's talk about the hot topic more on masks. Are they mandatory in Utah right now?
They're not statewide. There are only 2 counties in Utah of the 29 in which the mask mandates were put into place. And that only happened in the last week or so. The governor pushed back on the state epidemiologist when she said that they might need to shut down the state again. He said, I have no plans to do that, but he's considering putting into place a statewide mandate. He has a meeting with the state legislators next week. But doctors here increasingly really encouraging people, like the governor, to wear masks when they go out in public. I spoke with Dr. Orlandi here at the University of Utah. He's the leading physician when it comes to testing here in the area. And he talked to me about kind of the breakdown over the timeline when it came to mask wearing. Take a listen to what he told me.
Mask wearing has been an evolution. At the beginning of the coronavirus epidemic, it was more staying inside. But now as we're out and about in society more, the importance of mask wearing has really gone up. More and more people are wearing masks, but we need to continue to really just do that as a preventative measure for everyone.
So he did say it's a key preventative measure, and regardless of any mandate, that every single person should be wearing a mask. He did say if that statewide mandate were put into place, that could only help. Allison.
Maura, Utah is a conservative state that President Trump won back in 2016. What are people there saying about the way he's handled this pandemic?
Yeah, so like a lot of communities we've seen across the country, Allison, this really boils down to a lot of the more rural conservative areas that are pushing back on the idea of wearing a mask. It's this big political conversation that stemmed right from the leadership of the country. And so here in Salt Lake City, as I've been bouncing around and talking to people, people have adapted the idea of wearing masks, getting tested, being socially distant. But the doctor I spoke to earlier noted he went up to Davis County a couple days ago and nobody was wearing a mask. And so even though we're starting to see Republicans embrace the need to prevent this virus and be safe when you're out in public, it's still going to be a slow leaning development until everybody embraces that idea. That's why the governor on a call this week with the vice president really urged both Vice President Pence and President Trump to recommend wearing masks or to wear a mask when they go out in public to set an example. Even if they're not going to do a national mandate, he thinks that leadership and that setting that example could help. Allison.
A lot of folks saying that. Maura Barrett in Salt Lake City, Utah. Thank you so much.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.